How's it going, guys? I wanted to go over some of the really important concepts of being stuck at home and not being able to go to the gym to get normal mobility work in your warm-ups. Now that kind of effect, you start to feel like you're stiffening up over time, or if you've ever had a layoff from going to the gym, you go there and everything feels kind of stiff and it's hard to get depth on squats and everything, your chest is tight, things like that. So sitting around at home is actually going to cause that quite a bit. So one really important thing I want to make sure that we do is while we're chilling on the couch, hanging out, or just having bad posture in general from sitting around watching TV, as you can see while I'm chilling here, the angle of my hips is actually posteriorly tilted, which just means that my low back is rounded and my hips are kind of going forward. And what that does is it causes your hip flexors to start getting tight. Your psoas muscles that are deep in your hip girdle and attached to the back of your spine and your lumbar spine, those start getting shorter as well. And when that happens, you start getting tightness that makes you in this position. So when you stand up and you try and have good posture, it's real tight and it's real uncomfortable. So a lot of this mobility work is going to be focused on doing that. And if we can keep that loose, or at least more mobile, it'll keep the stress off of your lower back and hopefully prevent you from having injuries when you go back to the gym. So one of the best things you can do to try and get things moving, because warm tissue always stretches better, is just doing some body weight squats, even if you have to hold on to something, whether it's the side of the couch or a bar stool, whatever you have around, use a chair. Just take a normal shoulder width stance and just start getting in some body weight squats. Try and get below parallel, which just means your hips get below your knees. And from this, we're going to have a lot of blood moving. It will work your back, your legs, and all those components that we really need to start loosening up so you don't start having those back issues when you're able to get out of the house again. Now, one really good stretch for this is normally considered a hip flexor stretch, but it will also help the psoas if you do it properly. Many people have had this, take a knee with your knee directly below your hip and then slide forward. Most people have seen this. But what you're not usually told is that you want to keep your shoulders and spine stacked directly above your hips. What this does is it creates an angle from your knee to your hip to your shoulders that goes back. And this angle is actually what is going to help stretch out the psoas on the inside of the leg here where it attaches compared to back here where it originates. So when we're doing this, we're going to be stretching all of those muscles, hip flexors, and the psoas muscles, as long as you keep your chest up and not just lean forward like this, because you should feel a big difference when you bring your chest up. And of course, rotate to the other side. Chest is up, back knee is far back, spine is vertical, shoulders stacked on top of the hips. And one way to help accentuate this is if you get tight quads when you're not able to move very well, that can end up causing some patellar tendonitis or just aggravation that's underneath the kneecap. So when you have tight quads and you have that kind of sensation, that's usually what it's from. Your quads are just extra tight and it's causing the kneecap to press down onto the joint and it's aggravating the soft tissue below it. So one way to add in another feature of this, it's going to start looking like yoga, but it's the same stretch, but you grab your ankle and then you roll forward. Shoulders are still stacked above the hips. Everything is basically the same, but I'm going to try and pull my ankle to my butt. Then we switch sides, sit back, grab the ankle, do whatever you have to. Throw a hand on the floor for stability and then come up. Just make sure you have good horizontal movement or space between your front foot and your back knee. This is where your balance is going to be. Your foot can take care of the pitch, but this horizontal area right here, you need a good wide base for balance. Now, another big factor that goes into the back issues that people talk about is the piriformis. Piriformis actually goes in and attaches down on the sacrum and originates on the outer hip, or is it vice versa? One of the two. They grab there, they grab there. So if they get tight and your hips are out like this a lot, like we're sitting in chairs, and then the low back rounded posture actually allows that muscle to tighten up even more. So we need to make sure that stays stretched out. The pigeon pose, made famous, I believe, from yoga, is a really good way of helping do that. This will actually hit a lot of the lower outer glute area, the abductors of the hip, where we lay our leg flat and then try and bring our chest down to our shin, just like this. You should feel a lot of stretch. And if you want to try and accentuate the muscles that are over here, you should feel that down in your glute med area. And we'll switch sides. And then work on getting the chest down to the shin. Not trying to force anything, just allowing the stretch to do its work. Now, a lot of times that stretch doesn't necessarily hit the upper glute area where the piriformis is. Depends on how much you weigh, how tight your muscles are. There are a lot of different mechanical components that go into that and how it works. So, there are a couple different ways to try and hit that really hard and also help loosen up the musculature around your spine if you need that. The way I do it, and a lot of bigger guys can get away with this, is if you have extra body weight, is getting down to all four position. I'm going to be stretching this leg. My off leg is going to go behind it. As you can see, my knee is kind of back at my opposite angle, just like this. And I'm going to walk my chest over to the left, keeping my active knee directly below my hips, not up here, which is kind of where we were stretching before. But I'm going to walk off to that side that I'm stretching. And as you can see, my spine's going to rotate a little bit, but my leg is over here. And from this angle, it should be stretching my piriformis. You should feel it on the upper outer part of your glutes, just like that. This is actually a lifesaver for me because if you have a tight piriformis, you can also have IT band issues. This will hit part of those issues. And if it's the part that is actually causing it, it will help reduce that pain as well. But for the other side, same thing. All fours position, off leg is brought behind. My knee is on the opposite side of that shin. And I'm going to keep my knee under my hips and walk out to the side and allow this rotation to happen. And I definitely feel that in my upper outer glute right now. But if you are a smaller person especially, this next stretch will help with that as well. You don't necessarily need much body weight to be able to stretch that part of your hips out. This will also increase your rotational ability around your spine. So if you do a lot of squats, you'll probably start feeling a rigidity in trying to rotate your spine. I'm a really good example of that personally. But this is going to look complicated, but I promise it's not. I'm going to stretch my right hip. So I'm going to take my left foot, go under, and grab my ankle. Kind of makes a figure four position here. My hand over here is going to grab my knee. And I'm just going to pull across and try to get my back shoulder to the floor. So if I stretch here, I'm actually going to get a bit of a quad stretch on the bottom leg. And I start to feel the stretch on my outer hip on the top leg. And my back is actually going to be stretched out as well, because things like your QL can also get very, very tight from sitting around a lot. And this will help lengthen it out, particularly on the side that you are stretching the hip on. So we'll go through it one more time, switching all the sides around. I'm going to be stretching this leg, hopefully, the hip. So this foot goes under. I'm grabbing my ankle, grabbing the knee, and then pulling the knee across while pulling up on my ankle on the bottom leg. Backside shoulder is going to the floor. And it actually squeezes the air out of you when you do it right. That's why I sound a little funny right now. But just like this, you should feel the stretch in your hip, the bottom leg quad, as well as some muscles around the spine that are going to be lengthening and hopefully loosening. Now, another byproduct of us sitting around a whole lot is our shoulders get slumped, just like this, especially if we're at the computer, if we're watching TV, shoulders are going to be protracted. So a good way to help get your spine more mobile are the yoga poses. I believe it's downward dog, but I never really learned the names of the yoga poses. We just called this fat cat, and well, no, this is fat cat and mad cat. I think they have a lot of other names, but you know what I'm talking about. So mad cat, fat cat, working back and forth just like this. You can slide back into the mad cat position to also help this and get more spine mobility. And if you stay down and just walk your fingers out front, you'll be able to start getting some stretch in your shoulders. This will help stretch out your pecs and your lats and those internal rotators and your rotator cuff muscles that can get really stubborn and not want to stretch out for you. If you do that and make a conscious effort to try and pull your shoulders back, present your chest, that will help your posture and hopefully avoid the shoulder impingement issues that can happen from that long term. All right, made a mat adjustment here so I can show you this next one. But another really big problem area for muscles getting tight when we're sedentary, laying on the couch and hanging out, sitting in a computer desk, or all day long, whether you're at work or at home, either way, is getting tight adductors. The insides of your thighs right here, they're responsible primarily for bringing your knees toward the midline of the body. Some of them actually attach to where they can help with hip extension a little bit as well. I believe that's adductor magnus. It has two different attachment points or origins up on the hip. But regardless, what we're going to work on is getting into a side lunge position. This is a really great exercise in general, but I also keep this in the mobility work for all my clients to warm up with, just to make sure we can get good hip mobility to perform exercises properly. So you want to take a really wide stance, just like this. Basically looks like me squatting when I was still in competition. But the goal position is to be able to go down, keep your heel on the floor, knee out, this leg straight, shoulders above the hips, and stay upright. And you will feel a big stretch through adductors here and the short adductors on the bent leg as well. And some of these attach here on the inner knee portion, but some of them along the lines only attach halfway down the femur. Those actually have different tension points. So this will hit basically every part of your adductors, but this also hits certain shorter adductors as well. Now, not everyone's going to be able to hit that position right off the bat, believe it or not. So what we can do is try and progress slowly and make allowances in the technique so you can eventually get to that position. Now, getting out in the stance and keeping your hands on the ground is a great way to start doing that. So if I'm going to go to my left, I can walk over. Obviously my posture isn't great right now, but I'm going to be getting as low as I can, using my hands for stability so I don't fall, and also don't overstretch myself. That's going to allow the big stretch on the straight leg especially until I can work my hips down. And you can even bring your heel off the ground to allow, if your ankle mobility is what is holding you back here. You can still get upright and get a good stretch on the straight leg. So I need to go to the opposite side. You can brace on the knee. And for a lot of folks, this is the best they can do. But as long as you get to that point, you're doing this to try and progress. And any progress is progress. It's, if you continue to do it, you'll make more progress. And eventually, you'll look like a stunning ballerina, just like me. So some other good hip rotational stretches that you can do that will take a lot of stress off of your back and keep your hips more balanced is one that actually stretches out the external rotators like the piriformis I was talking about earlier, where we're going to have our knees about a 90-degree angle. I'm going to take this leg, point my foot to the outside with my knee being right at 90 degrees. And take my off foot, and press that down. And I'm going to try and keep my right butt cheek still on the ground, just like that. If my butt cheek comes off the ground, it's not actually stretching anything. So all these things have to happen together. Switch to the opposite side, just like this. Butt cheek on the ground and rotating down. You can do the opposite of this as well. If you want to work the external rotation mobility, you just cross the legs, lower legs on the same position, grab the ankle, push the knee, and rotate like this. You switch sides, grab the ankle, push the knee, slide up, push away. Now if you invert this and do it on your stomach, you can actually get a little bit more extreme of a stretch. So if I cross here, grab the ankle, and then lay, and then turn away from that leg. So those are just a few variations on those hip stretches. Well, this is a good start. If you guys have any questions, please let me know. I'll keep the videos coming to make the most of our time at home. Take care.